You dah habis exam kan semua, tapi of course lah 20 minutes standard lah.
Okay, so I have not patient A, a 10 years old Chinese girl, and during her admission for pneumonia, but have identified a few issues that this child has. Firstly, she had history of recurrent seizures since the age of 9 months old onwards, where she initially presented with status epilepticus and fever at that time. She was admitted in a private center, and at that point of time she was treated as meningitis. So subsequently, since the age of 9 months old, subsequently she had recurrent fitting episodes with or without fever, and with varying semiology at that time as well. So by the age of 1 year old, this child had already required multiple anti-epileptic drugs, and her seizure was still not well controlled. Her EEG and MRI done at the private center was told to be normal as well. So she was then at about 4 years old referred to PPUM actually to do a genetic testing, and from that onwards she was diagnosed with Dravet syndrome. So after this diagnosis, she was started on anti-epileptics, which were optimized, which were clobazam and sodium valproate, and her seizures were well controlled after that. So currently at this point of time, her seizure frequency was only like up to once a year, which was June last year. However, due to the prolonged use of anti-epileptics, she also had multiple adverse effects from it. One was a gum hypertrophy, and the other one was thrombocytopenia causing recurrent gum bleed and easy breathing, which was also optimized after they reduced the dose. Her other issue was this child also, since 3 years old, she had history of recurrent pneumonias, where her risk factors identified were ineffective coughing technique and swallowing incoordination, which could be as a consequence of the Dravet syndrome as well. So she was at her younger age, she was previously treated as protracted brachial bronchitis and bronchial asthma, and then subsequently she had a severe infection at 5 years old with strep pneumonia requiring intubation and ICU admission, and from then onwards she had a period where she lost for follow-up, and during the MCO period, and during that time she developed prolonged wet cough, which lead to her subsequent ICU admission at 8 years old, and from that admission they actually proceeded with a bronchoscopy and HRCT and diagnosed her to have bronchiectasis. This child was also subsequently started on nocturnal nasal prong, initially home oxygen and subsequently nocturnal nasal prong 2 liters at night. So as a complication of both this condition and more to the Dravet syndrome, she also has severe global developmental delay and also some development regression, where her current development age is about 18 months old. Mom mentioned that her early infancy development was normal up to about 1 year old. So currently she is also, due to this global development delay, she was previously attending private OT and physio and currently under PPKI. So this is also these conditions also cause a negative psychosocial impact to her family members, especially for her parents who are working as a dispatch officer and admin officer, earning about 5,000 per month, and this child during when the parents are working, she's also being taken care of the grandparents at home, and she also has another younger sibling. So otherwise, during my encounter for her examination, why she was a slightly overweight child. She is pink but clubbed, and she also has gum hypertrophy. Otherwise, she was not tachypnic under room air, but she has a chest deformity and Harrison sulcus. And for lung auscultation wise, she has cost crabs bilaterally. CVS and abdominal examination was unremarkable, and her neurology examination was normal as well, besides her slightly abnormal broad-based gait. So for this patient, for the management of this patient, I would approach her with a multidisciplinary approach. Firstly, also to focus on each problem. For Dravet syndrome and development delay, she will need a regular follow-up for the seizure control and to optimize the anti-epileptic drugs. And it's also important to monitor for complications of it. Otherwise, for the development part, she was already under OT rehab and she's also attending PPKI. For the bronchiectasis, she would need regular airway clearance technique, and also to prepare her to prevent to prevent further exacerbations. She's already started on inhaled corticosteroids on NAP 5% saline airway clearance technique at home. She also during admissions would need aggressive antibiotic therapy to fight her infections and also regular monitoring of her sputum culture and treating accordingly. She also requires a yearly echo surveillance to monitor for pulmonary hypertension. Other things that we can help her with is for extra vaccinations such as influenza and pneumococcal vaccination, to optimize her diet. If in case she regress further, develop sucking, swallowing incoordination, she would require rice tube feeding, but currently the child can tolerate already. Otherwise, we can support the family psychosocially, especially by letting them join associations like the Dravet Syndrome Association, and also to prevent exposure to smokers so that she will not get further exacerbation. Any questions, Doctor?
Yes, I have a lot of questions. So, just the Dravet itself, the seizures, the semiology and all that, what is it?
Actually got a lot of different semiology, but she started with GTC initially, the first presentation. Subsequently, she developed focal seizures and she also had a period of time where she had some absence seizures. But the current latest immunology, the last time she got seizure 1 year ago was still GTC.
Okay, so how's the seizure control?
Currently the seizure is well controlled because it's only once a year after they changed her to clobazam and sodium
So
valproate.
last seizures was once 1 year ago.
June 2023, more than 1 year already.
So on how many AEDs?
Currently only on clobazam and epilim.
Clopazam, epilin alone.
But previously she was on multiple including topiramate, ketogenic diet.
So what do you think? Is it just because of medication or is it something else that might contribute to the seizure well control?
One is because previously they did not have actual diagnosis of the Dravet syndrome. She was managed in private center. They tried, and the EEG was normal as well. So they just tried try and error a few anti-epileptics. So could be because of that. Another thing also because of the disease itself. Actually, it starts around infancy and then starts to improve at around this 9-10 years old as well. So maybe because of that.
So the Dravet syndrome genetically diagnosed confirmed?
Yeah, genetically confirmed. She had the SCN1 gene.
SCN1A gene positive lah. Okay, so that one settled. Alright, then the recurrent pneumonia, bronchiectasis, any status on the PID screening?
No, PID screening done before was normal.
Before normal lah. So since already on nocturnal CPAP under RESP, how's the recurrent rates of the pneumonia bronchiectasis as an acute exacerbation? How well is it now?
Actually, she's not on secret, she's on Nester.
I know,
but the exacerbation also actually markedly improved lah, because the last very bad exacerbation when she was 8 years old. Now the child is 10 years old, so in between she only had one after admission, so it's about once a year after they started her on the
any immunomodulator, antibiotics, immunomodulators?
She is on
azithromycin. Okay, so at home other than nocturnal CPAP, OT, physio technique, everything mother doing it every day, is it? Any naps, any clearance?
She is supposed to be on 5% naps line every clearance, and also MDI salbutamol BD, but the mother during when she's well only doing about OD lah.
Alright. Okay, then the swallowing coordination thing, how's the weight gain and all that?
Because that one when she was younger, it was a problem previously, but then as she grew up, she didn't require rice tube feeding. She actually, instead of failing to thrive, she's a bit on the overweight side.
So what do you think the cause of overweight now?
One could be due to side effects of epilin causing weight gain.
So many patients on epilin, I don't think so lah. Okay, alright, some more?
Other issue is that
How's the diet?
the diet.
Diet intake tak tanya.
Yeah, actually she's on normal adult diet, but the child also has
So you
a
need
lot
to find out where is it, where's the extra calorie comes
Yeah.
from. One thing. Okay. So developmental delay now 10 years old. How the current
She's
milestone
only
is at how
about
many age?
18 months old milestone.
Sorry?
18 months old.
18 months. I see. 18 months.
Currently she can walk, but sometimes a bit unsteady. She can scribble, speak only in single words, very few single words only. But this child previously, she actually, when smaller, she could talk more than that, according to mom lah. She could identify number and colors already up to 2 years plus. But then subsequently had some regression in the speech as well.
Okay. So the mobility wise how?
ADL part, mobility part, she can walk. But she is not able to run to climb stairs. She needs to hold on to a railing and just climb one step at a time. But the other activities of daily living she require assistance lah, such as for bathing, eating, changing clothes.
Alright.
Still on top.
So this one how many children? Family?
This is the first child. She has another 6-year-old sibling.
So two only.
Two only.
Okay. Then parent work as what?
Parents, the father is a dispatch officer, the mother is an admin officer.
So who's taking care of children during the office time?
Taken care by the paternal grandparents,
Paternal grandparent.
and grandfather.
So no issue lah for the past 10 years already then. Same.
But previously a bit tiring now also, because previously this child was attending a private physio and OT, which is more frequent during the week, and then that center already shut down. So now they're sending to PPKI. This PPKI is only about twice a week only. So most of the days the grandparents has the burden to take care of her.
So you don't know the status of why the overweight thing? What food intake and all that?
I did ask about this. This child actually takes normal adult diet. She's not taking milk anymore, but then it's a bit difficult to control her. Like she likes to eat junk food in between this last, so something that parents is a bit difficult to control her.
Okay. Alright, then in terms of neurologically functioning and all that, there is any
She's got no
contracture?
contractures and
Okay.
all. Neurology examination is actually normal, just that the cognitive and development part.
Okay, so in terms of that, there's no issue with constipation, issue with sleep?
No. Currently, no.
Okay. Alright. Okay lah, I think there's probably a bit of gaps here and there sahaja lah. The rest of assessment is quite alright. Yeah, the fact that you don't go through take the diet one is a clearing thing lah. Okay, I know your past exam already lah, but when you assess patients still the same, no?
Sorry.
Okay.